Okay, welcome back. If you saw that I did a video earlier today, excuse me, I mentioned that I was going to be doing a review of this therapy journal, and so that's what this video is about. I am going to start reviewing mental health related products that I find on Amazon, so that those of you that are wondering, how can I increase my efforts? What kind of skills do I need? Maybe you are trying to enhance your therapy already, or maybe you just aren't even convinced yet that therapy is something that you want to do, but you're wondering, what can I do that's going to help? And there are plenty of things that you can do. So one of my patients actually shared this with me in a session, and actually talked about it in another group that I was leading, and several people purchased it and are saying really great things about it. So I thought, this is going to be my very first review I'm going to do, and what a good one it is. So I'm just going to fly through this, and you can watch this, and please, I hope you will leave comments about it, because if this helps other people to, like I said, to increase your efforts in therapy, this is a great tool. So it is called the Therapy Journal, the mental health journal that makes the most out of your therapy sessions. So keep in mind, if you are not involved in any kind of professional therapy, this may not be the thing for you. But if you are, or you're thinking that you're going to get started soon, let me tell you from a therapist perspective why this is a really great tool. First thing is, this is early in the book, like just maybe 2 or 3 pages in. It has a place for important information. This would include your information as the patient, your therapist information if you are seeing 2 or 3 different therapists. Sometimes you have individual, family, group, marital, all of that. The page right next to that is crisis resource contacts. And so this gives you resources itself, like the suicide prevention hotline, which is also a text line. It has the it lists 2 separate things. So the suicide prevention hotline, the crisis text line, the youth line, and then it also lists local help centers. Now, I'm going to tell you what I would want people to use this for. This would be places like inpatient care in your area that have mental health or behavioral health units. And the reason why I think that this is important for you to list is it gives you a place for 3 different centers for teen support, for, like I said, just behavioral health hospitals. But in the event that you are struggling and you need your family member or your support system to find this resource, you're going to be listing your hospital of choice. So if something just goes terribly wrong and you need to be put inpatient because you are really struggling, you need to have your medications looked at, you've got substance abuse issues, whatever it is, this tells your family and friends and the local authorities what your place of choice is. Because let's face it, if you hop into an ambulance, they're going to take you to the local hospital. But if you have something on your person, or someone says, my loved one wants to be taken to X hospital, because we know that that place takes our insurance, or we just like the care that we received there, that is going to get you in a place at least that you feel comfortable with in a very uncomfortable time of life. So there's a lot of pages here that talk to you about how to use the journal. So feel free to look at that. I'm going to take you to, I think this is page 14, 15, and it says therapy goals, therapy tools that I learned. Now this is really important, because think about it. Picture this. You are in your therapy session, whether you're in person or online, and you are taking notes. Because as therapists, we love when our patients take notes, because it's going to help you to know what you agreed to work on, think about, read, whatever. And then when you come for the next session in a week or 2, you know what you're following up on. You're not just restarting because, people have therapeutic amnesia. It just happens. You don't remember what you talked about or what you were supposed to be thinking about. It's a tool that keeps everything in one place. So your therapy goals allows you to break it down. Like this example says, I will start exercising again 3 times a week, at least for 45 minutes each time. I will stop refusing my friends' invitations to get together. I will socialize again. That's the goal. I will journal briefly every day, answering this question: what are you proud of having done today? And so it gives you your actions, the date that you are working on that, or the day that you have achieved that goal. And these are things that you're not having to think about on your own. That's the difference. These are goals that you've talked about with your therapist in session, and then you are willing to say, I've agreed to work on these things. When people are dealing with goal setting, and I experience this a lot with my patients, it is so hard because just when you think that you've broken something down to a reasonable, realistic, I can't think of all the acronyms for SMART, simple, whatever they happen to be. I'm not thinking of that right now, so my brain's in a different place. You think that you've broken it down to the least level it needs to be, and then your therapist might help you to see, well, actually, you haven't really broken it down enough because you don't know what you're supposed to be working on immediately when the session is over. You're still back to, how am I going to lose weight? How am I going to make healthier choices? How am I going to work on this relationship? So make sure that you are asking your therapist if you need direction. So the next page says therapy tools that I learned. And this is one of my favorite pages because I'm all about skills. This tells you what tool you're learning. You describe it here, and then you can take notes on whatever it is that you learned. So let's say, for example, if I'm in session with somebody and I'm teaching them the 5-4-3-2-1 DBT grounding technique, they're going to write, here is the tool that we worked on in session. Here's the date that we did that. And here are my thoughts about it. Here's how I can use this in between sessions. I might use this when I'm feeling overwhelmed or super anxious, overstimulated, or I might write, I can use this skill anytime, or I need to use this skill when my feelings are at the intensity level of like a 6, 7, or above. So that's a great thing. Then it goes right into my last section I'm going to cover with this review, which is the therapy session notes. Therapy session notes, sorry, over here. This takes up the whole majority of the rest of this book, and it's really important. I am a therapist who believes heavily in checking in. If you want to see any of the videos I've done before on how to check in with yourself or how to check in with your loved ones, go back and watch that. When I'm checking in with my patients before they see me, they have a check-in sheet that they fill out that asks them questions on a scale from 1 to 10, how are you feeling? What feeling word describes how you are? What symptoms have you experienced since the last time we met? I ask the tough questions like, are you having any thoughts of harming yourself or others? Have you started a new medication? Have you had any substance use since the last time I saw you? What do we need to talk about in session? So in other words, as the timekeeper, what do I need to make sure that we are making time to talk about in this session? And this asks you some very, very similar questions before. What I like about it is that it breaks it down to before the session. So you can see this. Yeah, my mood before the session and my mood after the session. And it says, how do I feel physically, emotionally? What is the quality of my sleep? How was my week in general? And rather than using the scale of 1 to 10, it has happy faces or sad faces, which is what they use a lot in nursing. What is your pain level? And they base it on these particular faces that look like emojis. And then after the session. So why is that important? It's way more important for you as the client or the patient than it is for me. I might think that the quality of our session was off the charts awesome because I could tell from beginning to end that a person changed their level of anxiety while we were talking, that they were very participatory, that they showed a lot of great insight, a lot of improvement. Maybe I was hopeful because they started a new medication that I thought was probably a really good fit for them. But for the patient, you're seeing, I checked in at a 4. I'm leaving the session at a 6, right? So even if it felt like, wow, that was a really, really tough session, you were able to see progress was made. Talking to this person made me feel better, more hopeful, more encouraged than feeling worse. And so what they do here in this book, again, wonderful, wonderful things, especially if you struggle with, maybe you bring in a notepad to the session, but you just get off track. This happens with people all the time. They're so engaged in having the conversation in real time that they actually forget what they're supposed to be writing down. But if you're following this book, it has session date, session number, if you're keeping track of how many sessions maybe you've seen this particular therapist. It says next session date. So if you're someone who is seeing a therapist but not on a real regular basis, you want to write down so that you don't forget, because that's part of depression and anxiety too, is that you struggle with memory issues from time to time, or more. So you write the next session date, a check-in, pre and post, and then it gives all of this opportunity for writing notes. And so it keeps you on track. And especially if you are bringing this into a session, or you are maybe showing your therapist on screen, hey, I'm using this now. Because I know this is definitely something I do. I would say to my patient, are you taking notes? Is this something that you want to make sure and remember? And then you're able to write down, whatever longhand, shorthand, whatever code you want to use, you're writing things that you want to remember. Oh, they recommended this, or we made this connection today that my anger is really tied to this. This is why I get really triggered by this particular scenario, is because we tied it to this time in my life. At the bottom it says the main things I want to remember from today are. That's awesome. I love that. It says some ideas include homework, key takeaways, reminders for your next session, challenges to keep in mind, and wins to be celebrated. We can't forget that. In therapy, sometimes we're working so hard at feeling better from whatever was brought into the session that sometimes, and therapist included, sometimes we forget to celebrate what the wins are. Here's what you did really well. Here's where you were not in this place 3 weeks ago, but you are today. And so it gives you a chance to list that. So all in all, I would absolutely give this little book, which, by the way, I bought this used. And it's not even used. There's not a mark in this entire book whatsoever. But even brand new, this book is probably between $9 and $11, and it is well worth it. This will probably last a person, if they were seen every single week. I'm just eyeballing. I don't know for sure, but maybe about 4 to 6 months possibly. And of course, longer if you're seeing your therapist less frequently than that. But it wouldn't even hurt to have more than one of these, because having all of your notes in one place is going to allow you to look back, to very quickly reference, how did I check in 2 months ago? Patients all the time lose track of whether they are getting better or not, because when you are the person and you're just going through day after day after day, you don't always see your progress. It takes someone else pointing it out to you, but there's nothing like seeing your own words to look at this and realize numbers do not lie. My number is going up. I am reaching goals. And so, as I was saying before, if you decide that you needed maybe 2 of these for the entire year, that's wonderful. You can go back a year, 2 years later and look and see, I was doing really well when I was on this medication. That's another great tool, or a great use for this. I was doing really well when I was meeting with this therapist, and that stopped for whatever reason. I might need to, look he or she up and see if we can restart that. So 5 stars on Amazon for sure. 10 out of 10 if I'm doing a number scale. This is a really great thing. I'm glad someone finally created something like this. And I hope that you will consider looking at this in general, or something like this, because it will really enhance your therapy. And again, this is the therapy journal. There's no author to this listed at all. I would just say it looks like it says A Day to Remember is A Day to Remember is the name of these journals. And so you can look at them on Instagram, or you could email them if you'd like to give some feedback. But this is the 3rd edition of this. It was recently produced in December of 2021 is the most recent. And that, my friends, is my review of the Therapy Journal. I'll see you next time.